হ্যাঁ, রঞ্জনদা। হ্যাঁ, রঞ্জনদা।
হ্যালো।
হ্যাঁ, ইউটিউবটা দেখো, ইউটিউব এসে গেছে।
হ্যাঁ, আমি দেখছি। তুমি কি লাইভ করে দিচ্ছ নাকি
হ্যাঁ
এখন
হ্যাঁ
থেকে?
হ্যাঁ, না ওই যে 4:55 হয়েছে। চারটে
হ্যাঁ, 4:55 লাইভ করবে।
হ্যাঁ হ্যাঁ, হয়ে গেছে ভাই।
আচ্ছা।
দেখে নাও একবার।
হ্যাঁ, ঠিক আছে, দেখবো।
রঞ্জনদা,
হ্যালো।
হ্যাঁ, ইউটিউবটা দেখো, এসে গেছে।
হ্যাঁ, আমি দেখছি। তুমি কি লাইভ করে দিচ্ছ নাকি
হ্যাঁ
এখন?
হ্যাঁ, ওই 4:55 হয়েছে।
হ্যাঁ, 4:55 লাইভ করবে।
হ্যাঁ, হয়ে গেছে। দেখে নাও।
হ্যাঁ, ঠিক আছে, দেখবো। দেখে নিয়েছি, লাইভ আছে।
Good evening, everybody.
Yes, sir. স্যার, প্রিন্সিপাল স্যার ঢুকছেন।
It's okay.
থ্যাংক ইউ। স্যার, প্রিন্সিপাল স্যার ঢুকছেন।
It's okay.
আশিস স্যার, একটু মিউট করবেন স্যার।
Hello.
Hello.
স্যার দীপ্তজিৎ বসাক স্যারকে বলছি স্যার, আপনি যদি মিউট করেন স্যার।
করবো স্যার।
হ্যাঁ হ্যাঁ।
Principal Sir, good evening.
স্যার আপনি মিউট হয়ে আছেন, প্রিন্সিপাল স্যার আপনি মিউট হয়ে আছেন, আপনার মিউট হয়ে আছে স্যার। স্যার স্যালুট
Good evening, sir.
Good evening. So we're ready to start.
ইয়েস ইয়ে
Yes, sir.
প্রিন্সিপাল স্যার স্টার্ট করছি স্যার।
Yes.
Okay. So, good evening everyone. On behalf of Novaligaj Mahavidyalaya, I am Anup Kumar Saha. Welcome to all of you. One day state level webinar on preparedness for possible third wave of COVID-19, organized by IQAC Novaligaj Mahavidyalaya. Currently, India is suffering second wave of coronavirus pandemic, with India reporting more than 50,000 cases and approximately 1,000 deaths every day. In the light of crumbling healthcare machinery of the country, only vaccinating the whole population is likely to save us from the approaching third wave of the deadly virus. Unfortunately, India is facing a vaccine shortage with availability of the two vaccines, Covishield, Covaxin, in the country. In these situations, today's webinar will be very much useful to all of us from our speakers and guests. Today we have Dr. Dhubajyoti Chatterjee, Honorable Vice Chancellor, Sister Nivedita University. Dr. Ashish Mitra, Member of American College of Physicians, visiting faculty of Ruby Hospital and Amri Hospital. Today also we have Dr. Diptati Basak, visiting consultant of EEDF Medicare Center, Kolkata. Now I would like to request our principal sir, Dr. Sukamal Datta, to deliver the welcome address. Over to you, sir.
Good evening, everybody. It is a privilege that Professor Dhrubaranjan Chattopadhyay, Vice Chancellor of Sister Nivedita University, and an eminent scientist works on molecular virology and molecular microbiology will inaugurate our state level webinar on the most important current topic, preparedness for possible third wave of COVID-19, and deliver the keynote address. Professor Chattopadhyay is a well-wisher of our college, and many times he inaugurated UGC-sponsored state level and national seminars. We are very happy that such an eminent academician come administrator accepted our invitation. Then I welcome Dr. Ashish Mitra, MD on Medicine, MRCP, member of American College of Physicians, a senior visiting consultant of Ruby General Hospital and Amri Hospital. We are grateful to Dr. Mitra for accepting our invitation to deliver his speech as resource person and share his practical experience among the participants on the burning topic. Then I welcome Dr. Bitrojit Bosak, MD on Medicine and visiting consultant of EEDS Medical Center, Kolkata. He is very young but promising doctor. I am proud of him because he is only son of Sri Dev Kumar Bosak, accountant of our college. I would like to say a few words about why we have selected the topic. Being laymen, we the general public notice in newspaper, TV and social media that as per experts' opinion, third wave of COVID-19 would strike for the next few months, and the new variants, including Delta Plus, could weaken existing vaccines. Dr. Ramdev Guleria, AIMS chief, told a news channel that the third wave of COVID-19 pandemic in India is inevitable and could hit the country in the next 6 to 8 weeks. Delta Plus is present in 12 countries. The UK is undergoing a third wave of coronavirus infections as a result of the highly transmissible Delta virus. The government of India has advised the people not to lower their guard against the novel coronavirus because possible third wave peak of COVID-19, which is expected around September-October of this year. Niti Aayog's Dr. D.K. Pal said that the situation is vulnerable and the people need to follow discipline. A third wave can be stopped or at least controlled if COVID-appropriate behavior is followed and the majority of people get vaccinated. There are many countries where even second wave has not arrived. If we follow COVID-appropriate behavior, that is, wear mask properly, regularly wash hands and use hand sanitizer, maintain safe distance of 2 meters, and of course duly vaccinate, then we, the Indian, may control to some extent the third wave of coronavirus. So, thinking about the seriousness of COVID-19 third wave, we have arranged this webinar and to hear from a scientist like Professor Dhruv Chatterjee and two reputed doctors like Dr. Ashish Mitra and Dr. Bitrojit Bosak. Now, we are eagerly waiting for hearing from them. Last but not least, I welcome all the participants. I believe that their participation in the question answer session will clear how we, the common people, will prepare ourselves and protect ourselves from the third wave of COVID-19. Thank you everybody, thank you all. Now, I invite Professor Dhruv Chatterjee, Vice Chancellor of Sister Nivedita University, an eminent scientist, to elaborate our webinar, deliver his keynote address. Professor Dhruv Chatterjee.
Good evening to everybody. Good evening to our respected Dr. Shukumul Datta, the principal of Baliganj Mahavidyalaya, Kolkata, the faculty members of the Mahavidyalaya and from other colleges, and definitely the participants who are here. My co-panelists are two very eminent personalities, Dr. Ashish Mitra and Dr. Bosak. They definitely going to give a very important information from the point of view of the COVID warriors, who are actually fighting the disease from the front, to what we have to do for preparing ourselves for the possible third wave of COVID-19. Now, I just wanted to give you a little bit of idea that the blind spots in India's response to its second devastating infections serve as a stark warning to other countries. Month of February in India, people started to be very relaxed about what they should do and what they should practice. We are quite confident about that, oh, we are almost out with our COVID-19 problems, and we have gone to different types of mixings, different types of gatherings, different types of election propaganda and everything. And immediately we could look that the possibility of the different infections, the second wave, came in a very big way. Now, in retrospect, it was clear that the figures for these new infections that India was reporting actually from January and February, where the numbers, I still think that it's on the lower side, with a country of more than 1.3 billion people, seeing its caseload is actually increased and increasing every day. While there has been a focus on the most recent Indian variant of COVID-19, as much of the latest wave is also probably down to a combination of social behavior, weakness in India's health system, and policy decisions. You know that it is the second wave which tells us about the oxygen crisis, the tremendous situation where people are actually could not get their seats in the hospitals, and even people are very apprehensive whether they should report and go to hospital, because they think that in hospital it's not going to be cured and they cannot come back from the hospital. Whereas the data said different. The data is actually the hospital played such an important role during our first wave that hats off to all the medical practitioners at that time. But it is actually the way we looked the problem. Now, what we are actually going through, that the virus was conquered, vaccination started, making it controllable, and some of those who might have earlier have started tests will not have pursued that option, especially if confronted with less serious symptoms. Now, with a median age of 26.8, it seems likely to that, as elsewhere, the resurgence may have been driven in large part by younger cohorts, less concerned about a disease per se as being one that hits the oldest, and less healthy, disproportionately hurt, marking a now familiar recent pattern of transmission among the younger spreading to the older. I could see, I have number of informations where the son brings the infection to the home, and everybody in the home is actually gets the infection, from father, mother, everybody. And where actually the second of the infection started, it actually covers almost the whole family. So that is a number of cases we have found in this second wave, which is characteristically different from that what we have seen in the first wave. And from the scientific point of view, we thought about the different types of variants and the variants which can play some very important role. Now, the medical scientists are with us. They are going to give us a much more clearer picture about the whole thing. But I just wanted to mention a little bit about the variants of virus. Okay? Now, the virus which initially started from Wuhan, it has been found that from there, the CDC USA has established 3 classifications of SARS-CoV-2 variants being monitored. One is variants of interest, we call it VOI, variant of concern, we call it VOC, and variant of high consequence is VOHC. So these are the 3 different things. And now you can see in today's newspaper itself, and if you look at the different news channels also from all over the world, people are talking a lot about the VOI, the variant of interest, which may be the concern for our third wave. Now, in general, in the United States, they have found there are 5 VOCs, and the variants are actually there identified in South Africa in December 2020. Then in January 2021, it was, which is actually been identified in Brazil. Then the B1.427 and B1.429, the 2 variants first identified in California in February 2021, classified as variants of concern. But these variants seem to spread more easily and quickly than other variants, which may lead to more cases. And then we found that the vaccines are also started to come, and so far the studies suggested the vaccines which are available, the AstraZeneca, the Covaxin in India, they are pretty good actually neutralizing these different mutant strains of the SARS-CoV-19. Now the studies is still going on, and we are not sure about the efficacy of the results, but in general it was found that if you are vaccinated completely, you may have another infection, but the infection is not going to be dangerous. It will be a milder type. But rigorous and increased compliance with public health mitigation strategies, such as vaccination, physical distancing, use of masks, hand hygiene, isolation of quarantine, is essential to limit the spread of the virus that causes COVID-19 and protect public health. That is what we call as a Delta Plus strain, which is there and as mentioned rightly by the principal sir. So scientists are working to learn more about these variants, and more studies are needed, and we could see the Delta Plus which is coming right now. One of the reasons why we are getting a little bit of, this is from a virologist point of view, as molecular virologist I can tell you, the mutation giving rise to the increase in the infectivity of the virus. And when the infectivity goes up to certain level, now recently we found that the Delta Plus strain is almost 8 times more infective than the Delta strain. So possibility of people getting infected with this Delta Plus will be very high whenever it will come close to the population itself. And wherever, already we know that number of countries, as mentioned by Principal Sir, that number of countries are already, they are reporting the Delta Plus. Now, public health officials are studying these variants quickly to learn more about how actually we can think about the spreading. Now, when we are talking about the spreading, that the virus, when it is more transmittable, it has got a chance of more replication within the host. And if you have more replication, the virus will make more mistakes to give more mutations. And in this way, new mutant variant strains are arriving. But if it is so infectious that in one particular area, it covers most of the people, virus itself has got no life unless it gets a living person. So it needs a cell to replicate. So if the population is infected and they get the resistance developed against them, then the virus cannot go on. So what we can think that this particular Delta Plus strain or the more infectious strain is maybe possibly this is a last variant, last one, which is started to make this havoc. We already know the epsilon one and the lambda one, but the Delta Plus are more infectious than any others so far, whatever we have studied, and that's the CDC's responsibility, CDC's information also. Now the CDC is also working to monitor the spread of this identified variants, characterize the emerging viral variants, and expand its ability. CDC is also collaborating with the European Union to confirm that disinfectants on EPA's list, the disinfectants for coronavirus, inactivate these variant viruses. The CDC will provide updates as new information becomes available, and we are all looking forward that we have to understand that the public health mitigation studies is only going to be our preparedness and how actually we can combat our third wave. And the third wave, we have to understand that obviously vaccination should be there, but you understand because of the population. Though today we came to know from the Prime Minister's office that end of December is expecting up to 12 total vaccination will be there, because 12 to 18 they're now talking about the DNA vaccine developed by Zydus Cadila, which may be very effective because they have already been tested. Covaxin is also being under trial for the 12 to 18. So they are expecting the up to 12 the complete vaccination may happen end of 2021, end of this. But still we know that this will go on and it's not sure. So vaccination is one. As preparedness, we have to convince the people surrounding us that they have to get the vaccination. There is nothing that we should say. This controversy is there. Oh, that person has got vaccination twice but still getting infected. Yes, they will get infected, but the infection is not going to be so dangerous for them if they are not vaccinated at all. So vaccination is always going to prevent the virus to a great extent within the body itself. The physical distancing, you know that is also very important. The use of masks. We have to continue the use of masks, and I don't think that use of masks should be there because of our population density. There are a number of cases, number of countries they said that masks is not needed for the doubly vaccinated people. But you know that over here, mixing of the doubly vaccinated, single vaccinated, no vaccinated, all are there. So you cannot say that in our country, the population is so high, we have to think about mask is very important. The hygiene, it's I think it's one of the lessons of Corona that we have to think about our hygiene, the hygiene of ourselves, hygiene of our surrounding, hygiene of our neighborhood also, and not to be socially stigmatized regarding the infected persons. If we can actually fight out with this, then it is possible that people are not going to actually try to not to tell anybody that they have an infected person. So try to do that. Help the people if you get to know about that somebody is infected to that family. So the isolation and quarantine is the only way. And it's contingent. What actually right now the government is thinking that there's certain regions to be separated wherever the number of infections are higher is very important. And I'm sure with this we are going to prepare ourselves to limit the spread of the virus that causes COVID-19 in its third wave. Let us all try to prepare ourselves with all the lessons from the first wave and second wave, understanding the importance of all the different types of activities what we used to do, remembering that we have to continue with a lot of other our own activities, we have to understand that protection of public health, protection of life are very important. So please try to wear the mask, use the sanitizers, and try to keep distance while we are out of the system. Thank you. Namaskar.
Thank you, Professor Devajyoti Chatterjee, for speaking to us about preparedness for possible third wave of COVID-19. We really enjoyed your presentation, sir. Now I have the great pleasure of introducing Dr. Ashish Mitra as today's grand rounds walk speaker. He is a member of American College of Physicians. He is a visiting consultant of Ruby General Hospital and Amri Hospital. Sir, we are eager to hear from you. Over to you, sir.
Thank you for your kind introduction. Uh, Respected Principal Dr. Datto and VC Dr. Devajyoti Chatterjee, and after his excellent speech, he has delivered about the basics of the viruses and how to prevent it. Basically, first of all, I want to clear about the fact that our experience about this virus is say around 14 months only. So we have not read about this virus in our MBBS or MD curriculum. Though coronavirus was there, but this novel viruses experience is only about the 14 months. So what we have learned from our journey of the treating so many patients, and unfortunately we have lost many patients in spite of our best effort. Basically, the first of all, the preventive aspect, I would say, there is the vaccination is must. There are three vaccines available at the present, but please take any of the vaccines whichever you are getting at your locality, particularly at the hospitals or diagnostic center, wherever it is available through the COVID app or through the hospital. So try to vaccinate in a proper way, and most and the most of the vaccines are very much safe, and mild fever, headache can appear after any kind of vaccine. As you know, from the childhood you have taken several vaccines, so it is similar to the other vaccines. Actually, I am telling because I get at least 3 to 4 phones per day, or patients can ask me in the chamber, sir, whether these vaccines are safe or not. Basically there is no alternative way other than vaccine, because there are no treatment at present for this virus, against this virus at present, but by many of the drugs are going to develop in the near future. But the at the present time, the vaccination is the best way to prevent the disease. The three vaccines available at present in India are very much safe, and there are another 2 or 3 vaccines are coming in our basket in the next 2 to 3 months, and uh, so but the most importantly, that you have to take the two vaccines, and maximum protections will come after 2 to 3 weeks after the completion of the second dose. So I've seen that many patients are taking the first dose, and and they are thinking that safe to roam around here and there. But that is not the fact. Actually, after taking the two vaccines, the protection will come, and remember that the protection of these vaccines is around 70 to 80%, not 10%. But then you can ask what is the utility of taking the vaccines. As you know, that the government of India has started to vaccinate the doctors first. So we have seen that some of our colleagues also suffered from the COVID-19 even after taking two vaccines. But the most important fact that if you take the vaccines, the chance of severe disease is very much less. Even you can have the disease will be very much mild, and it can be jolly well treated at home. So that we have seen some of our colleagues who have suffered recently from the COVID-19 even after getting two vaccines. And if you go through the mortality of the COVID-19 among the doctors, you will see that during the second wave, and the mortality of doctors are less compared to the first wave, because in the first wave we were not vaccinated, but in the second wave, as the most of the doctors are vaccinated, so mortality is very less among the doctors. So taking this lesson, we can assure you that please be vaccinated at your earliest opportunity, particularly the senior citizens, and particularly most important those patients having some comorbidities like the hypertension, diabetes, heart disease, or any patients who are taking regularly medicines for diabetes, cancer, or any other chronic ailments. So these populations are very much vulnerable to have the severe disease. So remember, the only most of the patients, like the 80 to 90% of the patients suffering from the COVID-19 can be treated safely at home. Only 10 to 20% of the patients will need hospitalization, and among them, uh, 10 to 20% will need the ICU care and high dose, high flow nasal oxygen. So vaccination is the only way, and the second way, even if you get the full dose of the vaccine, then you have to wear mask, and maintain social distance, and the regular hand wash. That is the most important thing, and you need to follow this behavior. I would say at least 6 months, but better to continue for 1 year. And the most important thing is, the apart from the COVID-19, if you take mask, you have less chance of having asthma, or chronic bronchitis, or any other viral disease like the influenza, pneumonia, like that. So mask is not only protective for the COVID-19, but it also protects from the other respiratory tract infections. And regularly hand washing also protects from the other viral disease like the viral diarrhea and other bacterial illness like the your in our country, the gastroenteritis in this season is very much prevalent. So that will also be protected if you wash your hand in a regular basis. So this is very important, and keep safe distance, because as you know, the virus spreads in the air, particularly in the closed spaces, as you know, like in the cinema hall, mall. Those cinema hall is now closed, but even if after the lockdown is being withdrawn, please do not try to uh, get into the mall or cinema hall unless it is very much necessary. Better to spend your time if it is required in the open places. So that is very much important. And actually, the isolation, if you suffer from any fever, better to take only paracetamol. And we have a uh, behavior to take the over the counter antibiotic unnecessarily during the fever, but that is not required, because whenever if you take antibiotics, because it is a it is a viral disease, so antibiotic is not going to help you in the COVID-19 or any other viral illness. But if you take antibiotic in such a way when it is not required, so if you suffer from the severe illness when the antibiotic will require, so your body may not permit, so you may need high dose antibiotic or a higher dose antibiotic, which in the medical term is called antibiotic resistance. So please do not take any antibiotic without the prescription of a doctor. And we have seen that the isolation is the most important thing. Keep in a isolated room, if it is a possible, in a you separate toilet, but sometimes it may not be possible, as we are now living mainly in and the small flats. So this is a important thing. And thereafter, and the test. So unless you do the test, you may not know that you are suffering or not suffering from the COVID-19. So if you do the test, because we have seen that in during the second wave, actually one or two family members have been affected, and when the other members are suffering from the fever, they are not doing the test, and they are actually taking the same medication prescribed by the doctors. So ideally that should not be done, because that can spread disease. uh, so, and also the misdiagnosis and the wrong treatment can land up in a difficult situation. So that is the reason why in the second wave the mortality is so high, because many people are not doing test, and they are not treated by a doctor. So self treatment behavior is not acceptable during this pandemic. And so basically this is the most, so these are the most important thing, I think, the basics. And the most another thing that many we have seen that many people are treating, and they have tried to procure medicines like the doxycycline, ivermectin, or hydroxychloroquine, and there will be a crisis in the market, presuming that the disease can happen. But these are not the approved treatment as of now, and all those also the WHO and ICMR has banned this kind of drugs. And for the oxygen therapy, you have to check your oxygen level when you suffer from the fever, at least 4 times a day. And uh, uh, and the and the ideal oxygen saturation should be around 97 to 99, if not 100. But if your oxygen saturation is below 94, then it is alarming, and you can consult your doctor. The most important thing that we can tell you, that the at rest oxygen saturation can be more than 94, but if it decreases after the walk, we can tell your patient that you take just 6 minutes walk in your home, in the same plane, not in the staircases or like that. So after 6 minutes walk, if the oxygen saturation is below 90%, then it is serious, and you immediately consult your doctor, and may need admission in the hospital. So oxygen desaturation is a criteria, and otherwise the most patients can be treated at home, and particularly those patients who are already have the diabetes and the heart disease, heart failure, and any other chronic ailments like the asthma or chronic bronchitis or like that. So these patients should be very much careful, because COVID-19 may cause the severe illness. As you know, the lung is the predominant organ which is being damaged during the COVID-19, and this type of the patients should be better admitted in the observation ward, or at least safe home for monitoring. And another thing I should mention, that the COVID-19 can cause the new onset diabetes mellitus, and exacerbate the existing diabetes. And some of the patients we are treating with the steroids, and sometimes it may need the high dose of steroids, and steroids can cause diabetes. Though the duration of the steroid therapy is not more than 10 to 14 days in the most of the patient. Sometimes in the some of the patients where the extensive lung damage has been occurred, we can uh, he or she can be treated for up to 1 month. So that times the monitoring of the blood sugar is very much vital. So you regularly consult with doctor about your sugar chart. Sugar chart means we tell our patients to do blood sugar at home, which is called the self monitoring of the blood glucose, and you talk with your doctor with that chart, which is called the SMBG, self monitoring of the blood glucose chart. Basically we do 5 to 7 times a day, at least 3 times before each meal and at bedtime, and the 2 hours after breakfast, and the 2 hours after lunch. So this is the basic protocol. We have seen that the diabetes is really creating a problem during the COVID-19 treatment, and those patients who have been uh, hospitalized, particularly for oxygen or for ventilation or for ICU management, and they have to be followed up for next 6 months with his or her doctors, because the lung damage may persist even if your oxygen saturation is more than 94%, but you may feel any breathing difficulty at home, particularly when you are riding staircases or like that. And the most important thing is that the lung damage due to COVID-19 may not be evident by X-ray, or it may be underestimated by the chest X-ray. We need a CT scan. I know that CT scan is a very much costly investigation, but still it is the only imaging way to estimate the exact damage of our lung. So those patients which I have mentioned, that those patients who are admitted in the hospital and were getting high flow oxygen therapy or ventilation or high dose steroid, they need strict follow up with doctors even after discharge from the hospital for at least next 6 months, and also for the control of the diabetes. So in a nutshell, these are the basic principle we should follow, and the isolation is the most important thing whenever any patients are being diagnosed with the COVID-19, because I have seen so many patients, and I can just share one experience with you. One of my patient, the corporate official, so he has been diagnosed with the COVID-19. So, and he was very much afraid that the next 14 days, so how he will spend time for next 14 days in a isolated room. So he has thought, okay, I will I will arrange my food through Swiggy and Zomato. That is okay. But he immediately he was planning to run to the ATM from my chamber. So I have told, please do not go to the ATM, because once you will uh, put your hand in the key, and the same key will be shared by several persons, so the chance of infection will be there. So then he has understood the fact. So I told you that you can pay through the online transaction. So this is basically simple one example. So isolation is the most important. The vaccination and the isolation and the consultation with the doctor and the follow up. So these are the basic principle to tide over this crisis. So I think this much, and thereafter I am happy to ask, happy to answer any questions. Thank you.
Thank you, Professor Mitro. Dr. Mitro, thank you.
Thank you, Dr. Ashish Mitra, for speaking to us about preparedness for of possible third wave of COVID-19. We really enjoyed your presentations. We really appreciate you making time in your busy schedule to speak with us. Now I have the honor of introducing our next speaker, Dr. Diptojit Bosak, visiting consultant of EEDF Medicare Center, Kolkata. Sir, we are eager to hear from you. Over to you, sir. Yeah.
A very good afternoon to all. Mr. Vice Chancellor, sir, Dr. Shukamal Datta, sir, I'm absolutely honored and privileged to be with all of you today and being granted the opportunity to speak in front of you all. So without much ado, I'll start. I have actually divided my speech over a period of criterias and bullet points, as Dr. Ashish Mitra sir has already broad streaked his entire speech with the most challenging and the important aspect of dealing with COVID as from a medical point of view, as a medical professional. Also, the day-to-day challenges that we have to feel and face every day as a medical practitioner. So I'll be focusing more on the aspect of from the patient care point of view and situations and questions that I am asked every day during my work at the hospital, where I work as a critical care specialist and where I have to deal with patients and patient relatives on a regular basis. So to start with, I'll ask a question to you all. What is the aim to protect in COVID-19? Whom are we trying to protect? The answer is everybody. Until and unless each and every one of us, or at least the critical mass, or called the herd population, is immunized, vaccinated, or has been rendered immune to the disease, these diseases shall keep on spreading every year. Just like we have the influenza, just like we have the pneumococcs, like these are the strains of influenza, the H1N1, the H2N2, the H3N1, all these strains of influenza that keeps on rolling and coming every year. COVID, we can be absolutely certain that it shall come back to us each and every year and haunt us for the rest of our life, until and unless we reach that critical herd population of the herd immunization, or in simple words, immunize all of us. Just like we have done with smallpox, just like we have done with chickenpox, these are few specific diseases that has been rendered manageable by the WHO, by the combined effort of the WHO, by the ICMR and every other medical boards in the world. For example, chickenpox is now rendered negligible in the world. There are no cases of smallpox that has appeared in the last 100 years. And that has been possible only because we have done extensive vaccination over a century. So the aim to protect at this point is everybody, including the elderlies, the middle-aged, young generation, and the children especially. Now the question is, who are the vulnerable groups with COVID-19? The vulnerable groups will be especially the elderly population, like we have seen in the foreign countries, in our country itself, the children definitely, and also people with comorbidities. And comorbidities such as diabetes mellitus, ischemic heart disease, congestive heart failures, and all these kind of problems where we have an endovascular damage going on. High blood sugar level causes an endogenous endovascular damage. What is endovascular? The blood vessels of the system of our body is already damaged by the high blood sugar levels. And when COVID hits, COVID is microcoagulopathy. So what happens? It forms intravascular coagulations. So they form small blood clots within the system, and they aggregate together and may cause fibrosis, may cause infarction, may cause myocarditis, and all this associated problems. So the question is how to prevent. In simple words, you cannot prevent COVID. COVID is a virus. You cannot actually shut windows on a virus. What you can do is you can render your immunity higher and make it difficult for the virus to make symptoms, to create symptoms in you. In other words, you boost up your immunity and you make yourself strong enough so you can fight off the virus when you have been affected. India is in a stage where the virus has spread in the community level. We call it the community spread. So irrespective of whatever you do, including wearing mask, maintaining the 6 feet distance, that is a social isolation, washing of hands, usage of sanitizers, everything that you do, you're still at a risk of contracting this disease. But should you be scared with that? I don't think so. No. What you have to do, you have to protect yourself and also improve your immunity, and in the process, help your body to ward off the virus when you have been exposed or you are being affected by the virus. So, what is this vaccination that we're all talking about and that we're all getting? The jab, like we call it. Uh, Vaccination can be both active and passive. So, what is active vaccination? So, when a person or an animal has been artificially or naturally infected by a pathogen, in this case the COVID-19, we tend to segregate or take out the antibody. So the virus or the particle is an antigen that attacks our body, and the resultant macrophages, or rather the resultant defense that our body exhibits, we call it the antibodies. So we tend to isolate that antibody from the animal that we have actively and artificially inoculated with the antigen, and then we take it out from the system, we purify it, we make it a serum or a vaccine, that is an active vaccine, and we inject it into the system of the affected person and hope that the antibody will neutralize the already affected antigen in the system of the person. And then there is a passive vaccine. So what does passive vaccination do, or passive immunization do? So in passive immunization, we take a weakened state of the virus, or we mimic the virus somehow, and we reduce the virulence or the strength of the virus to create problems or nuisance in the system, and we inject it into the general population. And when the general population's defense system of the body sees that vaccine, it mistakes it for the virus. But being the virus, or the substance that is being injected being much less in strength and much weaker, it becomes easier for our defensive system or the immunity to overcome and then create multiple copies of the same macrophages or the memory cells, like we call it. And then when the person has been really infected, they can identify, they can isolate, and they can kill the virus in the real process. So is vaccination the only way to prevent COVID-19? I'll say absolutely not. Vaccination is not 100% effective. At most 60 to 70%, as Dr. Ashish Mitra sir has said, it is only 60 to 70% effective. And a question that I really get from all of my patients and relatives is like, if I have been vaccinated, what are my chances to get affected by COVID-19, or if I'm exposed to COVID-19 virus, will I get affected or will I get sick? My question will be absolutely. If you're exposed to COVID-19 virus, there is a very high chance that you will get sick, that you shall get affected by the virus. But the chances of manifestation of the disease to a very severe level, or the virulence of the virus, is supposedly to be lower. So if a person who has not been vaccinated is exposed to the virus, and me as a person who has been vaccinated, I'm also exposed to the virus, the chances of me being seriously ill is less than the person who has not been vaccinated. So it is always wise to get vaccinated, because that shall help us to achieve this herd number, or rather the herd immunity in a given community of people. Then comes the question of lockdown. Is lockdown effective? I would say absolutely yes, unless it's followed to the core. A lockdown should be absolute, like it was done in the countries like US, in UK, in Canada, in Australia, where only the essential services, and who are really essential to the day-to-day functioning of our civilization, not just the society, was allowed movement. Other than that, every other person was conspicuously and actively encouraged to stay home, stay indoors, and break the chain of transmission. Once we break the chain for transmission, there is a model for contagion. As Vice Chancellor Sir would agree, being like a microbiologist and epidemiologist himself, there is a triangular model for contagion: the agent, the host, and the carrier. So the agent is COVID-19, we are the host. And what is the carrier? it is the droplets, the air, the sneeze, the cough, the droplet infection, the droplets that we spread in the community while we cough, while we sneeze, while we put hands anywhere in our mouth and nose and touch unprotected surfaces without washing our hands. So that is the carrier. So once that we break that chain or the triangle of transmission, we can cut down the rate of transmission to a very, very effective level. Like we have seen in this lockdown period, that during the month of March and April, the infectivity rate has gone up to a certain severe number that it was effectively impossible to admit patients because there were no hospital beds available. It was very difficult to provide oxygen support to all because we had faced an acute oxygen crisis in our country that was unprecedented. In modern times, actually, the 21st century, the amount of oxygen shortages that we have seen. And so to prevent this kind of recurrence, or rather to prevent another uprising of this disease or the cases, we have to absolutely break the chain of transmission. And that is only possible when we limit our social exposure to each other, or rather in a community as a whole. So talking about the oxygen requirements and shortcomings, since we are all expecting an imminent third wave of the COVID-19, and that is supposedly targeted more towards the younger population more than the elderly population, as the hypothesis goes, my what should I say? My recommendation to you all and to the people would be to minimize upon the use of the protective gears. Already in the last 18 months, we have used enough PPEs, gloves and masks and caps and hoods and everything, and that has caused significant environmental consequences. The PPEs that are single use that we use every day are discarded, and that is just now medical based. So while we are battling COVID-19, we are also forgetting the environmental footprint, the carbon footprint that we are leaving at our way while battling the global pandemic. So here what we can do is we can minimize the contacts. We should get ourselves treated only when it is absolutely necessary. There are certain aspects that we should keep in mind while we are isolating in our home, and I should get back to that later. I should come back to that. And before that, let me talk about the oxygen situation. So, given after the second wave fiasco, the oxygen shortage was seen to be of critical level in this country, and not just in our country, even in other countries as well. So we need more oxygen plants. We need more oxygen delivery system. At a certain point, the oxygen production was enough and adequate to the need and the demands of the hospitals and the people, but there weren't enough containers to transport the oxygen to and fro from one place to another, or rather from the place of production to the affected area where it was required. So we would require to focus more on the logistics of transportation, the logistics of production, and also, rather should I say, the fair usage policy of oxygen, where we should use oxygen only when it is necessary, and also keep a tab upon the protocol. How much, when, and when to stop. How much oxygen should we provide to a patient, and at what oxygen requirement levels? What is the blood gas of the person involved? And when to taper down the oxygen. Oxygen, as much as it's good for our health, is also bad because it causes something called oxygen toxicity. And indiscriminate use of oxygen can actually prove to be more harmful than beneficial. Also, we would need more ventilators, more high flow machines. I know Calcutta, or rather Kolkata as a metropolitan city, we are pretty well equipped in our hospitals with our high flow systems, with our central oxygen line, with our ventilators. But let's step back a while and let's think about the condition in the rural areas, in the outskirts, where the hospitals aren't equipped with as many ventilators, aren't equipped with as many high flows. So we would need to focus on those areas as well, because if we put all the dominant pressure on a metropolitan city like Calcutta, keeping in mind just West Bengal, and rather in all the metropolitan countries, in all the metropolitan cities, it becomes overwhelmingly difficult for the medical professionals to provide effective help to people. Because if my hospital is equipped for 100 patients, and if I'm getting a request for 1,000 patients, it just becomes impossible for me to provide effective treatment and effective support to my patients. So we would have to provide effective and logistic care also to the outskirts areas of Kolkata or other metropolitan cities so as to upgrade and uphold the infrastructure that they have. Now, we'll talk about the Delta variant and the isolation protocol. This Delta and the Delta Plus variant that has been recently on the rise is definitely a cause for concern. Countries like UK, the Canada, the New Zealand, and the US have already reported numerous cases of the Delta and Delta Plus. So why should we be skeptic, or rather be wary of this strain? Because Delta and Delta Plus is supposedly thought to be much more effective at transmission than the previous, the epsilon, the beta, the alpha variants of coronavirus. So, if a person has a delta strain of virus, he or she will be much more susceptible to spread this virus to other non-suspecting people at a faster rate than what we have seen in the second and the first wave. The first wave had spared us the horror and the pain and the suffering, but the second wave didn't really leave us anywhere. We were struck hard, and we were struck low by the second wave, and we weren't really as much as prepared for it by the severity and the intensity that was inflicted upon us by the second wave. So for the third wave, I would really expect, and I hope that we are much more prepared and in a much better situation to cope up with the impending inflow of patients, to provide them with quality care, with better assistance and management, and of course, post-COVID care. Also, I'll come to the post-COVID care in a bit. So now I'm going to ask you, what about the use of masks, gloves, and sanitizers in case of Delta and Delta Plus variants? I would say it is very, very important. Delta and Delta Plus is also COVID indeed. Nevertheless, the use of gloves, sanitizers, hoods, masks, everything remains of paramount importance. These are all preventing and declining the chain of transmission. So once again, if we cannot isolate ourselves at our home for eternity because we have all work to do, we're all professionals, and someday or the other we will need to get out of our house. When the H1N1 outbreak happened, people got indoors, they kept indoors, and they were in isolation. But that was not for eternity. People had to eventually go out. And now we have a vaccine, which we have to repeat every year, the influvac vaccine. That helps towards reducing the severity of the influenza virus and the influenza-induced pneumonias that we see each year. That is a seasonal variant. And we see each year in the month of October to December a huge surge of patients with influenza-related pneumonias and other complications. So the mask, gloves, sanitizers, and all those preventive measures are equally important in the Delta variant as well as the Delta Plus strain, because the main aim is to keep the idea of transmission low, if not absolutely inhibited. Another question that I often get from my patients and relatives is, what is ECMO? We call it ECMO. So ECMO is extracorporeal membrane oxygenator. Why do we use that? We use it in cases of patients who are severely ill, who are very, very sick, and they cannot maintain their oxygen levels in blood adequately enough to sustain life on a ventilator. A ventilator has different stages and different modes and different settings. So when we use the volume control of a ventilator and we use it to the fullest extent, even then the patient with lungs so compromised that he or she is not being able to monitor, or rather maintain oxygen saturation that is conducive to life, we might have to look towards a better variant of oxygenation to the body, and that will be the ECMO. And ECMO in the recent times has proven to be very, very effective in preventing mortality. And we have a few certain cases in our hospitals where we had to shift patients to a highly sophisticated centers like Medica and all those hospitals where patients were supplied with ECMO support, and they did revert back, and they went home. They were discharged in healthy conditions. So we are very hopeful that in the coming days, if patients do tend to get worse on ventilatory support, ECMO shall prove to be extremely useful. But obviously there is the cost prohibitory effect of ECMO, which is very, very expensive to maintain. So we would also have to work towards making it more accessible towards the common people. Also, the government, by providing, I think, grants and providing more machines and making it more easily available. Also, training for ECMO is not very easy. It requires intensive training to control these machines. Not everybody can do that. So I think more doctors are to be treated, are to be trained towards ECMO and making them accessible to the lower centers as well by providing proper infrastructure would definitely help reducing the mortality of COVID-induced pneumonias and COVID-induced complications. So there is also the thing about tocilizumab, the remdesivir, the steroids, and anticoagulants. So there is this notion among predominantly Indian population that tocilizumab and remdesivir can cure everything. Uh, I would actually beg to differ. Tocilizumab has found to be absolutely, or rather really effective in cases with very high degree of severity of COVID. It has seen not to be changing the outcome of patients who have already been severely infected, where a huge portion of their lung capacity has been diminished or the lung has been severely affected by the fibrosis induced by COVID, or the pneumonia has been spread extensively. In those cases, remdesivir has not yet proven to be very useful. But the research is still going on actually. Last month even we had a patient with because of the patient we had to communicate with some of our colleagues in US who are actually working on tocilizumab and remdesivir and trying to figure out the real efficacy of these drugs. But yet we are using it, but at the same time we should be really judicious. We have all seen that there was this huge scarcity, and still is actually, of these drugs, including tocilizumab, remdesivir, the steroids even, the doxycycline, and all these drugs that are rendered life-saving in these times. There has been a huge shortage, and that is because of panic hoarding. People aren't aware how these drugs work, how they help us, but because the media or the government or us, the doctors, rely heavily upon these drugs, there is a tendency to hoard them. Just like toilet papers in the US. During the first wave, we have seen instead of anything else, Americans were hoarding mostly toilet papers. Absolutely evades me why, but still, toilet papers was the main cause for concern. So for us Indians, we have seen that we have hoarding tocilizumab, we have been hoarding remdesivir, and we have been hoarding drugs like dexamethasone, prednisolone, and HCQS, obviously. So my suggestion in these cases would be, do not hoard drugs. Medicines are available. India is a quite developed country. Like, contrary to what everybody might say, I do consider India to be a quite developed country compared to other third world countries. So we do not really have an acute shortage of drugs when required. If we do not hold, if we do not keep the drugs away from the market, hoping that it would come in later use, it's not going to help us in the long run because drugs are expendable. They have an expiry date. So anything like a drug that you're holding will eventually run out of its efficacy, will eventually run out of its expiry date, and it shall be rendered useless. So neither you nor the person who really requires it could have access to it. So it would be my earnest request to everybody through this webinar that drugs like remdesivir, drugs like tocilizumab, drugs like dexamethasone, these are best left to the discretion of the medical practitioner to prescribe and to administer. And let us be the judge of when to give it to you, because drugs, if administered and given improperly, non-judiciously, shall and will do more harm than good to you. The question is now when to see a doctor. Not every flu is COVID, and not every COVID requires urgent medical attention, or rather invasive medical attention. So let's say I am a patient and I get COVID-19. I'm not sure. I have the symptoms of cough, flu, mild fever, headache, retroorbital pain, that is pain behind my eyes, a bit of sore throat. I do not have any respiratory complaints like shortness of breath or constricting feeling in my chest. I do not have any of those complaints. My pulse oximeter shows that my oxygen saturation level is 98, 99%. Do I need a doctor? I would say yes, but you do not need to go all the way to a hospital and get admitted there to get one. You can see someone at an OPD basis if he or she is available, or you can go for the online consultation with your doctor, with your family physician, and ask for his or her recommendation and opinion about what he or she might think about your condition. He or she might prescribe you with certain drugs that would alleviate your symptoms and also help you, like, get better hold of yourself and not panic, because the one thing that we tend to do while we are all alone in our isolation, that is we panic a lot. A drug causes more harm to us in our mind than actually it does to our body. So let the doctor decide your situation. Let the doctor decide the severity that you're facing right now. COVID is inherently divided into three major segments or three groups of severity: the mild, the moderate, and the severe. So for the mild variants, who have the mild variants, they can be very well treated at home or safe home. Then comes the moderate. So when we are suffering from a moderate variant of the moderate severity of the disease, the question is, do we get ourselves admitted in a hospital or do we not? My question will be depending upon the symptom and the qualifying symptoms and the qualifying problems that you're facing right now. We can actually decide whether you need hospitalization or not. So for a patient who is suffering from high degree fever, severe cough, has a bit of shortness of breath, then the inevitable next step would be to get himself checked for RT-PCR. That is the reverse transcriptase polymerase chain reaction, the nasal swab. So when you have severe symptoms like cough and fever and running nose and difficulty in breathing, without any decrease in saturation so far, you would be wise to get yourself tested for COVID doing an RT-PCR. There are other variants of testing like the CBNAT, the RAT, that is the rapid antigen tests. All of them are good, but personally, I think the RT-PCR, that is the reverse transcriptase test, has been the most efficient and the most specific of all those tests. So if we are talking about mass testing a population, I would think that I would go for a test that is more sensitive, like the RAT test or the CBNAT, which generates report in a very short time, in a very short period of time. So it will be easier to segregate, isolate, and test a large group of people in a very short time. But when we are talking about specificity, or rather whether we need to be absolutely sure whether the patient is really suffering from COVID and we are not just getting a false negative or a false positive report, because that will actually hamper the treatment protocol, in that case, I would suggest that the patient should undergo a rapid transcriptase, that is the RT-PCR test. Now I have got myself an RT-PCR test done. Next what? The report comes back to be positive. Then the most sane thing, or rather the most logical thing to do would be to get an HRCT. The question will be, why not a chest X-ray? Chest X-ray, as Dr. Ashish Mitra sir has already specified, is not a very effective mode of diagnosing the lung injury that has been caused by COVID. HRCT thorax gives us a very detailed and clear picture about the opacities, the consolidations, the ground glass opacities, and the involvement of the lungs in which lobe and in how many segments. So everybody who has, like almost all of us, I believe, has already seen or has got to know about the CT severity score. When we see a CT scan report by the radiologist, we see that there is something called a CT severity score. And that is actually a very good marker to apprehend and wonder whether the patient would require hospitalization in the long term. Because if a CT severity score is, let's say, 15 or 18 out of 25, the parameters have changed, by the way. Previously, it was thought to be 25 different segments, and now we have increased the CT severity score to up to 40. So what is the CT severity score? It is the number of lobes and the parts of the lung that has been affected by the virus and has been affected to an extent that it is showing changes in the lung parenchyma. So that is essentially the CT severity score. And when we see that there is a very high number of lobes or segments or parts of the lung has already been affected, then it would be probably wise to get yourself admitted in a hospital setting so as to ensure proper monitoring, and in case you do develop an oxygen requirement, that is your oxygen level is going down in the blood, we can provide immediate support with extracorporeal oxygenation. Then comes the mode of treatment. So do we all need steroids for COVID-19? I would say no. Steroid is recommended only when we face an acute shortage of oxygen or where there is hypoxia. The one test that every COVID patient has to undergo, and it is not very comfortable, that is called the arterial blood gas test. So once we start with the arterial blood gas test and we see that the blood oxygen is really low, we can go for the steroids. Not everybody requires steroids. Not everybody requires remdesivir. Not everybody requires tocilizumab. So again, we come back to the point of not holding this medication, not knowing whether you might need it or not. Let us, the best leave it on to us, the medical professionals, to decide when and where to use these drugs. Preventing panic. I believe preventing panic is very important in this situation because panic creates anxiety. Anxiety creates a surge of blood sugar in our system, and blood sugar, as I've told in the very beginning of my speech, causes endothelial damage. What is endothelial damage? It causes micro damages in the blood vessel lining. And COVID, being a microangiopathy hypercoagulable state, is already causing damage to the blood lining by the blood vessels by causing microclots and thrombus all over. So better not panic and increase your chances of hospitalization by making yourself weak, because anxiety also causes a hypoimmune state. Your immunity goes down when you're in a constant state of panic and anxiety. So do not panic. Let the doctors handle. We are always here to help. We are just a phone call away or just a Skype call away. We can always help you guys, and preventing panic is the first thing that you can do to yourself, to help yourself, before we take over to help you all. And one more thing that is very common these days, and it is actually going around in the grapevines, is COVID a hoax, as claimed by the no-maskers, just like the flat earthers. We have this community called the flat earthers, so they believe that the earth is flat. And then there is also this community of people who do not believe that COVID exists, and that wearing masks and using all these chemicals as sanitizers is just government propaganda. So I would actually implore to them, I would actually like to request them to give up this notion that COVID doesn't exist, because COVID actually exists. And because you don't believe that that the disease doesn't exist, doesn't make it disappear altogether. But what you do is you prevent us from reaching that herd immunity. So let's say a community has 2,000 people, and the herd population would be around, let's say, 2/3 of it. And 800 people doesn't believe in the fact that there is COVID. So if those people do not get themselves vaccinated, if those people do not use masks or practice social isolation and social distancing, they're actually preventing the society or the community to achieve the herd immunity, and in turn they're affecting the entire society. So they're actually taking us back away from a cure or from the prevention. And one last thing that is very pertinent in today's days, that is mucormycosis and the steroid problems. Yes, mucormycosis, we have seen cases occurring these days in my hospitals even, but one common notion about common people is whether mucormycosis can happen to me. I would say absolutely no. Until and unless you are an immuno-incompetent person, someone who is in a hypoimmune state, that is someone who has low immunity, you are not in a danger to get mucormycosis. In a very, very rare case, those are exceptions. So what causes hypoimmune state? Causes low immunity, number one, stress, anxiety, panic, steroids. Use of steroid is inevitable in severe COVID cases because they prevent inflammation. It's very important and is one of the mainstay of our treatment. So we have to use steroids. But in the long run, steroid causes hypoimmunity by reducing the cortisol levels in our blood, also reducing the ability of our macrophages and the white blood cells to fight off bacteria and opportunistic infection. So mucormycosis is just like another opportunistic infection that occurs only when the individual's immunity is low. So us, the common people, the general population who are not in a hypoimmune state, we do not need to worry about mucormycosis as a whole, because mucormycosis, or rather rhizopus, the preprint organism of mucormycosis, is everywhere. It's in the bread that you eat in your breakfast. So rhizopus is a fungi which is present everywhere, and unless me as a person is in a really, really hypoimmune state, also a person who is suffering from HIV or AIDS, right, AIDS. So those are the very, very susceptible groups. In our case, in the present scenario, the COVID cases, severe COVID cases where long-term steroid has been used. So those are the susceptible population that, they need to be taken care, and utmost work should be done to prevent mucormycosis, because once mucormycosis is developed, there are a few certain ways of getting rid of it, like surgery in case of radical mucormycosis spread, formation of tumors and the SOLs, and in other cases where the lung has been affected, we have to use antifungal drugs like amphotericin Bs and all those very expensive drugs. So we have to be very careful and vigilant about the fact about judicial use of steroids, judicious use of antibiotics, and also preventing panic as a whole. I would like to thank you all, Mr. Vice Chancellor Sir, Dr. Shukamal Dr. Sir, my very kind patron, and every one of us present here for giving me this opportunity yet again to keep a bit of my views and ideas in front of you about COVID-19. Thank you very much.
Thank you, Prince Potter.
Yeah. Thank
Thank you, sir.
Yeah. Thank you, Dr. Diptajit Basak. We really appreciate you making time in your busy schedule to speak with us. The session is very good, and what to say, it's really nice, very informative, very useful to all of us. Now we are in QA sessions. So I am asking all of our participants to ask your questions. Please ask questions one by one. Please.
Hello, my question. Vaccination will work in our body to protect ourselves from the serious illness due to COVID-19.
Okay. Actually, the protective period of this COVID vaccination is near about 3 to 6 months. But practically, it will protect you for a year, because it is just like the influenza vaccine. You need to vaccinate every year, because the strain will change, the virus strain will change, and according to that strain, the manufacturer of this vaccine will change the vaccine. So it is, I will not say that this pandemic will persist for year and year, but it may persist in a low grade fashion in some part of the world. So that's why we need to vaccinate against the COVID-19 every year. But the protective effect till now, the vaccines which are available in the Indian market is near about 3 to 6 months.
Yeah, participate, please ask your questions, please. So I think if we don't have any, yeah, if we don't have any for yeah. I think if we don't have any further questions, then I would request Dr. Tamalturu Rai to deliver the vote of thanks. Over to you, Tamalturu sir, please.
Thank you, Professor Anup Shaha, and I am in pleasure to get the opportunity to give vote of thanks to this auspicious webinar conducted by our college. Actually, we are very much uh, very much what I'd say. Uh, mm, this webinar has create lot of give us lot of suggestions regarding the present pandemic COVID, and the two experts, Dr. Ashish Mitra and Dr. Diptajit Bashak, has shared their expertise and views how to protect this COVID and what are the measures to be undertaken for and preventive measures to be undertaken to control the COVID. And we have gathered a lot of knowledge regarding this disease COVID. And I was affected by COVID in May, at the very beginning of May 2021, and I am very much I was very much alert of the disease. After attack, I have consulted a doctor immediately. As Dr. Bosak said, I didn't wait even a day, and so I was not very much badly affected by COVID. I was safe, and I could control the entire situation. And my child, who is of 8 years old, and my wife also was affected. But it does not create huge problem. Within 2 or 3 days, I have been uh, I got well enough from the COVID. I got recovered from COVID. Now, actually, today's webinar gave us the opportunity to know the COVID, actually the disease COVID is, and how we can recover from this. And first of all, I would like to thanks to Dr. Dhubajyoti, Professor Dhubajyoti Chattopadhyay, for his address as keynote speaker. Thank you, sir. Secondly, I'd like to thank Dr. Ashish Pitro for his excellent deliberation and his expertise views regarding this COVID pandemic. And next to Dr. Deepajit Bosak for his excellent deliberation and his sharings regarding this COVID issues. Okay, and how could we control this? He has explained in a very lucid way. And during my COVID session, I have consulted Dr. Deepajit Bosak, and he has given me a lot of suggestions. And today also his deliberation was excellent. And thank you, sir, for your excellent deliberation. And next to Dr. Sukamal Datto, our beloved principal and respected principal, for his thinking of organizing such an webinar for for us and for everyone, because today uh, we know that COVID may attack us, but how can we prevent it? And so this webinar will help us to get lot of knowledge and to acquire lot of knowledge how to protect COVID. Okay, how to fight against COVID. So thank you, sir. Thank you, Dr. Sukamal Datta, our principal, and all the participants. And thank you, Professor Anup Kumar Saha, his excellent organization and excellent way to conduct the entire webinar. And last but not the least, to all the teachers, teaching staff, and the college officials who has attended the webinar to make it a success. Thanks to all of you on behalf of Navadiganj Mahavidyalaya and on behalf of not only IQAC, entire Navadiganj Mahavidyalaya family. I again thanks to all the participants, the experts, everybody for making the webinar a success. Thanks to all of you. Thank you, sir.
But
Uh,
before ending, I just want to congratulate the principal, sir, Professor Shukamal Dotto, because I think this is the first college which is organizing something as preparedness for the third wave. Nobody else actually done that. You know that Gloria's lecture just 3 days back said this awareness for this COVID third wave, we have to spread it all over to schools, colleges, and universities everywhere. And I really congratulate the team of your college under your leadership. I must also thank the Anup Kumar Shaha and Tamal Tarun Roy for being the conducting this and giving the vote of thanks. But definitely, I want to thank the participants who are with us: Brotuti Pal, Kuhali Pramani, Onnisha Shingupto, Chirunjip Shaw, Devish Kumar Acharya, DP Laidi, Gauranga Roy, Jafar Ali Khan, and Dr. Lopamudra, Kollani Dhar, Mudhumita Khan, Munisha Shah, Moumita Marik, Najmun Nahar, then Purvita Bose, Ranjan Sengupta, Sanjay Dash, Shantanu Mondol, Shantini Datta, Sriparna Vishwas, yeah, Shujata Mitro, and definitely Tushar Kanti Das, along with my two co-panelists, Dr. Mitro and Dr. Boshak. You have done a wonderful job in establishing the fact, and I'm sure all the participants, you are going to make your neighborhood aware of these facts, and you want to be the again forerunner for this. Let us get prepared for preventing the third wave. Thank you. Namaskar.
Thank you, sir.
Thank you, sir. Thank you, Dubajit sir.
Thank
Today,
you so much.
today we can end the session over here. Thank you, everyone. Thank you, all participants and dignitaries. Yeah, thank you. Have a good night.
Welcome, sir. Good night.
Bye. Bye. Bye.
Thank you very much.
Bye.
Good night.
Good.